Hi Margaret, thanks for taking the time to speak to us today during Carers Week to tell us about how the Belfast Trust Cancer Support Service can help people caring for those affected by cancer.
Thank you for this opportunity to talk about some of the issues that carers face and also how we as a service can help.
Thanks Margaret. So I suppose the first question that's worth asking is, what is a carer?
Well, a carer in this case is someone who provides unpaid help and support to someone with cancer who couldn't manage without that support. Now, we know that a lot of people will see themselves as a husband, a wife, a son, a daughter, or even a really good friend, so may not necessarily see themselves as a carer.
Yeah, I think that's one of the issues, that people don't naturally identify with that and then don't get the help that they need. Yeah. So from your experience working in the centre here, what are the main issues that carers bring to the centre and to this service?
Well, there's a lot of issues that face carers. That could be emotional, the practical, but one of the main things that we find with carers is that they need information. Now that could be information about cancer, its treatment, how the treatments will affect the person they look after. It may be access to the wider healthcare team of which we are part. So there's quite a lot of information and support available for patients. Some of the other issues that carers tell us is that they feel lonely and isolated, and it could be that the person they would have talked to in the past may actually be the person who now has cancer, so they don't want to burden them with their worries and concerns.
Very good. So I suppose a service like this is somewhere that they can just come to talk openly about those worries and concerns.
Absolutely. We provide a listening ear. We provide an opportunity to talk about things that may be on their mind, even how it has impacted on themselves, this diagnosis of cancer. And we do that in a very non-clinical setting, giving you time and space to talk about what's on your mind.
Great, Margaret. So what other types of support do you provide for carers within this service?
Well, look, the bills don't stop coming in. The kids still need collected from activity. You may still be working, trying to hold down a full-time or a part-time job while getting someone to the hospital, looking after other things that might be what the person with cancer did. So there's actually quite a lot of the practical issues that need to be taken care of, and that could be things like financial advice. If you have to take a lot of time off work or maybe have to reduce your hours down, that can have a huge impact on your finances. And it could be that the other wage earner within the house, the person with cancer, has to take time off. So that's a huge hit for someone's finance. So we do have a benefits and financial advice service within the centre that we can make a referral to, and they can look at all aspects of to benefits, right through to giving advice about mortgages or pensions or whatever financial aspect that's impacting on you. We also can put people in contact with services that provide practical help, whether that's a bit of shopping or maybe even a service that sits for someone for an hour to let the carer get out and do what they need to do. We can also, if there's children involved, we can also direct people to specialised service that helps support the children and the wider family.
Very good. So there's a lot of that emotional support as well, and helping people manage the anxieties and stress around, somebody within their family or close to them having the diagnosis.
Absolutely. And one of the most important thing we say is that carers need to look after themselves. Lots of studies have shown that actually carers' health can actually take a hit when they're looking after someone. Now, what we provide in the centre is designed to help support the carer. That could be helping them relax, helping them to maintain their fitness. We do a whole exercise program, yoga, tai chi, Pilates. So it helps the person to look after themselves and take a wee bit of time out for them as well.
Thanks, Margaret. It sounds like there's lots available out there to help people, and it's wonderful to hear that there's all that support for not just the person with the diagnosis, but their close friends and family. Finally, I want to ask, given your background and the work that you've carried out, in the centre and in the service again, you will have experienced lots of issues from carers, and you will have developed experience on what helps carers. So on this Carers Week, are there a few top tips that you would give that carers can take on board that will help them with their role?
I think one of the main things is to talk to someone, you know, get that additional support. You know, that could be another family member, and it could even be the person with cancer. Sometimes what we find is that, you know, the person with cancer is worried about the same thing as the carer, and just getting it out in the open can really help. So everybody knows what's expected of them, and also what they can do to help. There's also the thing about actually look after yourself. You know, get some sleep. Good quality sleep can really help set you up for the day, and we can help with that in terms of the complementary therapy and relaxation techniques. You know, go for a walk. You know, just 30 minutes to take a walk in a nice place can really restore you and set you up for your current responsibilities.
Thank you, Margaret. Again, we really appreciate you taking the time to speak to us. So if somebody did have caring responsibilities and wanted to avail of some of this help, how might they go about that?
It's as simple as lifting the phone. Give us a call on 028 961 500 77. We are here to help.